what's going on, guys? Blake here. So, purpose of this video, I'm going to do a quick little demonstration on the proper sequencing for putting on, or donning is another term that CDC uses, but we don't. Putting on personal protective equipment, so gown, glove, goggles, face shield, mask, all that different stuff, and then removal or doffing your PPE. So I'm going to show you two different times. Both are valid by CDC standards. Okay, it's really finding whatever one kind of suits you best. It's something that once you're working clinically and you do this 1,000 times, you don't really think a whole lot about. I even have to think for a moment if I'm trying to share with my sequence for somebody, just because it becomes muscle memory. But at first, it's important that you're putting things on and taking them off in a manner that you're not really having any cross-contamination. When you're putting them on, it's not as big of a deal depending on where you're working at. You might be going into an OR, working with a burn patient or something, where you're trying to keep stuff as aseptic as possible and everything like that. So let's talk about the most common pieces of equipment where you're going to be dealing with. So you have just gowns, usually, pre-COVID and stuff, we just call these isolation gowns. It could be to protect you from a patient that's on, extended or enhanced precautions, and we know they have something like MRSA or C. diff or something like that, and we're trying not to contaminate our clothes or anything. You could also be putting on certain stuff if you're getting ready to go into a trauma and, standard precautions, and you're worried about some sort of substances getting on your body. These ones, usually if you're at the hospital and you're going into a room or a particular area where you're going to have to use these, they'll be mounted on a door, or there's a stack of them outside of the room or something like that. So most of the time it's already there. It's just knowing what all you need to put on and how to put it on and take it off and everything. So these are usually individually wrapped, and these are disposable ones, all right? Whenever you open them, especially depending on this, circumstances of why you're going to be wearing them or anything, you want to make sure you're not dropping these on the ground and getting a patient, something from that's off the floor or something like that. And likewise, you don't want to rub your hands all over or anything. Usually we're doing this for self-protection in many instances. So I want to point out these are, you can see me through it almost, they're paper. So these are not impervious gowns. So if you're dealing with something where there's going to be a tremendous amount of blood splatter, fluid spray, and things like that, you want to get an impervious gown. And unfortunately, it's like where a lot of times, they come in many colors. They're usually, like in my experiences, blue, and they're like a plastic material, and it's like kind of wearing a blue trash bag. Times are tough when we got these gowns, and it was in times of COVID, so we had to be happy for anything we could get. I want to point out that these do require you to be able to tie a knot behind your head and your shoulders and everything. A lot of ones at the hospital, fortunately, they got a couple of features that are actually very user-friendly and shave off a little bit of time. Very often there's a head hole, meaning instead of it being a tie, there's actually an already created opening, and all you have to do for putting the gown on is sliding your head in, and then there's just a separate tie for the waist here. These ones require a little bit more skill, okay, but once again, in my experiences, most of the hospitals I've worked at, you're not going to end up having a situation where you have to tie this behind your head. Now, there are some certain areas like burn unit or reusable gowns where that maybe is the case. So you want to make sure you don't do anything crazy for a knot. Should be nice and quick release. You are, in very many instances, just going to tear and break this, so it's usually okay. Likewise, if you do have to tie it, you don't want to tie it so loose where it's hanging down and you have a big part of your chest exposed or anything like that. I'm going to go ahead and slide my arms through. I'm going to point out another little thing here. These gowns have this elastic little cuff. That part is nice because it's going to make sure everything's kind of sealed up and everything like that. But, once again, and not to generalize, in my experiences, most of the gowns I've encountered at various facilities in various cities and things like that, not only do they have the head hole, but they actually have gowns that have a little thumb slot right here, and they don't have the elastic cuff. The elastic cuff's going to be problematic whenever we get ready to take this stuff off. The ones with the little thumb hole, it makes it very useful because as I kind of progress through here, I'm going to show you, we're going to go ahead and we're going to be able to put our gloves on very easily, and it's going to make it much easier for taking off. So when you go to clinical, you're more than likely going to have ones that don't have this elastic cuff, and you're meant to just put your thumb in this little hole, and that allows the glove and everything to kind of be pulled back. For these particular ones, it's a little bit more challenging, but once again, kind of not the standard here. All right. The other thing about these gowns that we have in our lab, goofy, never really seen it like this. They have the two tie straps anchored on one side. Really, really strange. All right. A lot of times they come from the front, something like that, or they come from the back, and you're able to kind of loop them and then tie a knot right here in the front. So this is a little bit strange. They are extra size though. So what I do, kind of pull it nice and snug here up front. Tie a nice, easy little release knot. But once again, as we kind of progress through this stuff, I'm going to show you. I'm not usually untying. I'm going to go ahead and rip stuff and everything. So we have our gown on, all right? Depending on what type of precautions your patient is on, it's going to really give us all the full details of what types of PPE we're going to need. I'm going to show you the full guard, but if we're going into a patient that's just on contact isolation or something of the sort, we're worried about brushing up against the bed rail or that patient and transmitting things to our skin and scrubs, we might just go ahead and put gloves on. I mean, time in COVID, you're always going to be wearing a mask, okay? I'm going to show you the full shebang here. I'm going to show you face shield, mask, all this stuff, both, Donnning and Doffing here. So you'll see people do things differently. You start putting your gloves on at this point and everything like that. The gloves are really going to be our last part that we put on, just because we don't want to start touching a bunch of different things, maybe touch our face and then transmit anything to a patient or anything like that. So I'm going to go ahead and put a mask on here. Now, the particular mask I'm going to show you is a little bit more involved. This is kind of a traditional design N95 mask or respirator. Okay, you have to be fit tested for these and everything. This would be for your airborne patients or anytime you're aerosolizing something and you could possibly have a patient with a droplet or an infection that's traditionally droplet spread that could transition to airborne or respirable particles. So whether that's COVID, you're giving an to an influenza patient, anything of the sort here. Times of COVID, respiratory, we're usually walking around with these nonstop, and you're actually probably going to use that same mask and not be changing out every single little patient. It kind of depends on where you're at here. So with these, it's important that we got the right size and we're fitted. I would automatically fail because I got this bushy beard, or it's trimmed up kind of nice and short right now. But you can't have facial hair making any contact because airborne particles could kind of go through there, okay? So I've already done hand hygiene and stuff, but I still want to be cognizant of all what I'm touching. With these particular masks, usually you can see there's two straps, and they're different because you got a strap up top and a strap down bottom right here. A lot of these other masks, the ones BJC you're using, for instance, primarily SSM, they have a uniform spot where the straps come, and you don't have to do this little crisscross technique. But I'll usually try and get this on my face here first, okay? I'm going to pull both these straps back up and over my head. What I like to do is I'll take that bottom strap and get it kind of on the crown of my head. Some people, and I got a large head, I can go ahead and get a pretty decent seal by putting both of them on the crown, but some people, they'll crisscross like this, something of the sort. What you want to do, there's a little metal piece right here. You're going to go ahead and squeeze that. You want to make sure that you got a good, nice seal on your face. Even in the context of being fitted for masks, you still want to make sure you do a self-check, okay? Take a couple of deep breaths. You shouldn't feel air spraying in the eyes. You shouldn't feel air coming out anywhere or anything like that. You should almost feel like that mask is seated to your face, okay? So go ahead and always do a little self-check before you do something like that. If you were just wearing a regular standard droplet mask, okay, so you're not doing any airborne type procedures, they're not on anything, you're just in the hospital for regular, standard type precautions, and you're wearing a mask to protect you and the patient, or if they're on droplet precaution or something, you'd just be wearing a surgical mask. So not as involved, it's just preventing things from kind of really depositing in our mouth. Face shield, very common. You might be wearing this or goggles, okay? Oh, I broke my face shield here. Hang on one second. I have a rather large head, and these are not the highest quality, so we'll see if this thing kind of holds up. All right, yeah, I look cool, huh? So I got my face shield N95, so this is going to protect me from eye splatter and things like that, or anything kind of deposited on my face. Great for traumas, great for intubations. This is a little involved one. They do make, like, most of the time for intubations, if I'm going to wear something or we're up at the head of the bed doing something, they make regular droplet masks that actually have a little face shield built in. But these are a little bit more extreme, and they are pretty nice here. So I'm going to go ahead and I'm going to put my gloves on. Once again, generally we're doing the gloves last, okay? So if at any point I touch my face or touch anything funky, you're going to go ahead and make sure you do proper hand hygiene. So as mentioned, I got this elastic cuff here, which can be great, but it can also be problematic as far as taking them off, and it's going to involve another little bit of a step. But we want to make sure that you don't have your wrist exposed, because it kind of defeats the purpose of wearing all this stuff. So when I put my gloves on for these, I'm gonna have to either tuck that or pull it back over the elastic strap and make sure I'm safe. You know, best practice probably to pull that elastic strap all the way over. If we had the ones with the thumb hole I was talking about, it's really easy. You have your thumb hole, your thumb's through the hole, and you're gonna slide everything in the glove, and the glove envelops really the cuff of that gown. So I'm gonna go ahead, I'm gonna put my gloves on here. So you can see I wouldn't want to go in like this where I have everything kind of exposed. So with these gloves really aren't long enough for me to really pull all the way back, so I'm actually going to pull that elastic cuff up and over my gloves like this and get a nice good seal. So I got my gloves, I got my gown. You can see these ones are a little bit open in the back and everything versus some other ones, but that's usually okay. We're usually facing the patient. I could go in and do my thing. If at any point my gloves became soiled, I'd want to take those off, perform proper hand hygiene, and go ahead and put another pair of gloves on, okay? Let's say I just went ahead and finished everything I needed to do with this particular patient. We're gonna go ahead, I'm gonna show you two different techniques how to remove your PPE in an appropriate manner. Now, I will tell you this first technique, it's what I learned, it's what I do and everything like that. A lot of people don't. It's how I learned it. The CDC still recommends it. But your board exams do typically throw some stuff at you where they'll follow this sequence rather than the second one. And I only got a little bit of beef with one aspect of the second technique that could be potentially problematic, okay? So the first thing I end up doing, all right, because I'm assuming everything in front of me is contaminated, my face shield's probably contaminated, my gloves are the dirtiest thing, all right? I like to go ahead and while my gloves are on, I go ahead and rip this, all right? A lot of times I'll go ahead with these particular ones, I go ahead and pull and rip. If it was the one with the head hole, you don't have to do anything like that. You can go ahead and once your gloves are off, you can reach back behind and you can kind of pull that gown off without contaminating anything. But we're gonna assume that our gloves are the dirtiest part here right now, okay? So what I'm gonna go ahead and do, once again, if you have trouble, and these are actually pretty strong, you could give it a little tear and rip that if you wanted, okay, but you're not pulling it all the way off. I don't generally do that. I can get behind it and pull everything. So I'm gonna take my gloves off and I'm gonna show you. Gloves are really dirty. I'm gonna grab this and kind of pull, all right? And I kind of got this thing going inside out. The inside of the gloves should still be okay, so I can touch everything. I can go ahead, I can kind of get this glove started. Everything's kind of self-contained. I didn't have to touch any part besides the part that was rolled over, and I was touching the inside. So gloves are off. I'd throw it in a trash can. I'm gonna throw it on the table here right now because I don't have a trash can nearby, okay? So my gloves are off. If I was freaked out that I did this in an aseptic manner, I touched something, I could go ahead and do a little hand hygiene. If I got something really funky on there, go and find a sink. If they're visibly soiled, use soap and water instead of the hand sanitizer. If I wanted to for good measure, I could go ahead, nice, vigorous stuff with some hand sanitizer and everything like that, and we're all good, all right? I'm gonna go ahead and at this point, I can go ahead and take this stuff off of my face, so my face shield, because I'm stepping away from kind of patient care here, okay? I don't want to touch the front of this. I don't want to try and touch my head or my skin or anything as best I can, but usually if you grab kind of in the back, I'm just grabbing that strap, I can go ahead and remove this. Now, keep in mind, if you were in a COVID unit or in times of COVID, you might be wearing that face shield and that N95 mask the entire time here, okay? If not, you know, you can go ahead and follow what I'm doing, but just keep that in mind. You might actually skip that step and just be removing your gloves and your gown and wearing this from patient room to patient room. Now this is where, this next part I'm gonna take off is the gown, all right? And this is the part that I don't like with these elastic cuff. I need to try and take a finger and get back behind that little elastic cuff and get my hand inside of it. Once my hand's inside of this, I can go ahead, I can use the gown to grab itself. And as mentioned, like I don't always, on these, I don't always pre-rip or anything like that. I could go ahead and rip this off. If you had a head holder pre-perforated, then they can tear. Likewise, you could lift up one over your head if you really wanted to. So I'm gonna go ahead, I'm kind of pulling out. I'm only touching the inside of that gown. I'm gonna go ahead, I'm gonna throw it on the table here, all right? But I could go ahead, and at this point, I have my gown off, all right? All I'm left with is my mask. So if I really need to switch my mask off, with something like that, I'd still probably go ahead and wash my hands. If they're visibly soiled, I'd go ahead and do soap and water. If not, a little hand sanitizer and be totally fine. Now, I got to take my mask off. Now, at this point, this patient was on precautions or something like that. You're usually outside of the room or away from that patient. In the old school airborne type precautions, we'd be in what's called an ante-room, or you got the patient room, there's a little tiny room outside, okay, and that way you got a safe place to take, don and doff all this stuff and everything like that. So I wouldn't want to take my mask off right next to the patient, usually by the door or something like that. If I am going to take it off, and this is my big thing with everybody that's wearing masks during COVID and stuff, it's great, don't get me wrong, but people don't know how to take this stuff off. You see somebody wear a ratty mask for a long time, and what are they doing? They take it off. They touch the face of that. Well, this is all contaminated. What we're trying to do is kind of grab further in the back, and these are a little bit tough, okay? You're trying to grab the strap and not the mask. So with the droplet ones, it's way easier because you can just grab right back behind your ears. These are a little bit tighter, so I'm trying to not touch myself, but once again, I've washed my hands if anything funky's going on, and then all I'm doing is pulling this off. Pre-COVID, we just throw this away or whatever. Now, once again, you might be wearing a mask the entire time here, all right? So that, at this point, I have all my PPE is removed, okay? You guys are gonna go ahead and be putting on another droplet mask at this point. Before I do anything though, even though I was diligent about all this stuff, I'm gonna go ahead and wash my hands again, okay? So whether you wanna do soap and water, hand sanitizer, kind of depends on your comfort level and what all you maybe touch while you're doing this stuff, and also what exactly the nature of that patient encounter was and what's going on. The COVID or the C. diff or C. diff, definitely gonna soap and water and things like that very, very thoroughly. All right, so that is the way that I remove PPE in a very slow manner. Once again, I could do it in 10 seconds if I wasn't trying to talk through this stuff, something that becomes very second nature. So you keep that in mind, that's one option. I'm gonna show you another one really quickly here. I'm gonna go ahead and put this stuff on in super speed and then do the removal here, okay? So I'm gonna go ahead and put another gown on here. This is Danielle's primary way of putting this stuff on. So I'm gonna go ahead, or not putting on, taking off. You'd be surprised, but having to tie that knot really slows you down. So the benefit of this removal technique that I'm getting ready to show you is that it goes a lot quicker. And sometimes you could argue that it makes more sense in many instances because it's less likely for kind of cross-contamination type issues, okay? Yeah, they really make these for people with normal sized heads, I guess. I have a large noggin. Okay. For your checkoff, any of these are valid as long as you don't have any sort of cross-contamination issues or dirty yourself or anything like that. Okay, so I'm all garbed up, going to my room, do my thing, okay. Let's say we're all done. I'm gonna go ahead, break this. Oh, that ripped kind of crappy. She goes ahead and rolls the entire thing inside out, removing gloves and the gown simultaneously, okay? So if, like mine, my gloves are getting a little hung up there, everything's rolled inside out, I'm only grabbing on the inside, and then I'm done. The only problems I have with that, and once again, your board exams doesn't necessarily follow that, at least currently. It is CDC approved and everything as far as doffing your PPE goes. You can have problems with the glove. Likewise, you could have it where your glove gets pulled off prematurely and then your bare hand is sliding against those sleeves. A little bit of caution and taking your time, and it should not be an issue, okay? So at this point, if you wanted to, you could go ahead, do a little bit of hand hygiene. If you did touch anything, same deal. Remove my face shield. All right, I could wash my hands if I thought I touched something, and then I'm gonna try and grab far back on these masks, remove that, wash my hands, and then I'm good. So that's just a little demonstration. We'll still practice this in class. I'll show you my way, I'll have Danny show you her way, and then you can kind of pick and choose and see whatever one you'd like to do. Once again, for your competency any of those techniques are appropriate as long as you do it in a logical manner and everything like that, all right? So that concludes this particular video for Donnning and Doffing PPE. We'll talk about it a little bit more detail in lab, but I hope that helps. Good luck.